Hey, what's up everybody? I am here with Dr. Chris. We are talking about drop release. If you have not seen or heard of this, you're gonna wanna check out this demo for sure. What we are going to break down is how you can utilize this in your practice. We're gonna do a live demo, as I said. If you have ever seen anybody in your practice or yourself that has chronically tight or short muscles, this is an instrument you're going to want to take a look at. He's going to go through a protocol with me live and hopefully give you some insight into what it is, what it does, and how it can make a big addition into your practice. So with that, I'll let you take it away.
All right, thanks, Jeff. So basically what we have here, kind of a menacing looking object, but what it is it's basically a T-bar, soft tissue tool, with a drop piece built into it, like we're accustomed to using in a table. So what I'm going to do with Jeff here is, prior to starting this, we took a little look at how his joints move, and he's got a little bit of a hyperkyphosis going here, so it's going to play into this a little bit. But if we bring him into shoulder flexion, if I don't allow his thoracic spine to extend or allow his scapula to move, this is as far as he's going. Want to swing that way? You guys start on the table?
Sure.
Show the lovely people. All right. So this is what we got right now. Go ahead and spin on around here again. So what I'm going to look for here, now it's protocol-wise, basically what we're going to do is we're going to find the joint that we are addressing, find the joint that is restricted in movement in some way, and we're going to take that joint to its limit at the moment without allowing compensatory movement. So let's have you hold that up right there. I'll actually, a lot of times, will really use my head. Very professional. So I'm going to get in here, I'm going to palpate and find, okay, what is limiting his movement? Here we got some tight lats limiting movement. We got subscapularis that does the same thing. Of course, everybody's favorite muscle, the pectoralis minor, we can get up underneath it. We can get a hold of that guy. And he's got the nervous smile on. He knows what's happening. So we'll bring this up here. So I'm going to put him at end range. We're going to find the most limiting tissue, the one that's sticking up at you the most. And we're going to bring that up there. You can actually have the patient actively do this motion, so you want to hold that up.
Okay.
I'm going to engage that tissue with the end of the tool here. I'm going to add a little extra stretch to it by pressing it in, and then when I overcome the mechanism, it does that fast drop, just like the table, which imparts a fast stretch to the tissue. And that's just one drop there. You can already see we're definitely increasing. So now the area I was working has released, right? But if we get down here and do a little bit different division, that's pretty tight as well. So let's have you hold that up again. And when you have the patient hold it up, you get the benefit of the reciprocal inhibition relationship also. So you get some of that. It can be helpful. Bend here, hand behind your head. So now I'm going to get it more into the pec minor. So I'm going to get up underneath here, and the nice thing about it, I can get around the corner with this, so to speak, around the corner of the pec. I'm going to get a little more tension. This is a variable tension tool, just like your drop piece.
More tension.
A little more tension. It's for all those comments you made. So we're going to get up underneath here. I'm going to catch that pec minor. I'm going to bring it up and drop, and there. That. Pretty lovely. Let's see. All right. So without allowing thoracic extension, that's actually really pretty good.
Yeah.
Let's take you into external rotation one time. I just want to that subscap.
Yeah.
You're hoping to escape the subscap. So there's a little bite to this, but think about your pin and stretch techniques. That's minutes worth of.
And then how do you know if you need to hit it again, drop again, or whether you're done? It's a pre and post test. You're getting end range feel and range of motion.
Right. And this is where the kinesthetic sense, your motor skill as a practitioner of manual techniques comes in. You can tell if you're at capsular end feel, or if you're in tight tissues, that kind of thing. So if I bring you up here, see, something still feels a little bit funky over here, like this way, and that just might be your shoulder morphology, actually. But I will not change your shoulder morphology with this tool. There, it's a little pec major, I think, actually. So if you want to spin sideways again, and let's get you, yep, sitting up like you were. Let's go hand up above the head again. And so here, we were about here, right?
Yeah.
So we probably added, I'd say close to, probably 20 degrees in a matter of very short amount of time. Now you're also, this. I just got to take my hands off, otherwise I just keep falling more. You know how it is. There we go.
So do you recommend this, if somebody's doing active care in their practice, do you recommend this pre-exercises, for lack of a better way to say it, post-exercise? Where in the workflow? Or pre-adjustment, post-adjustment?
So I typically will, depends on what I'm working.
Okay.
Right? If I'm working on a shoulder, I'll usually clear the thoracic spine first and the neck, and because the longer I'm in practice, the more convinced I am that if we don't clear shoulders and hips, the spinal areas around them are just gonna, get out of place again, get dysfunctional again, for lack of a better term. So like here, I make sure both sides are moving, because the lats are such a big player with the thoracolumbar fascia, and they can affect everything all the way down there. But typically, to get back to your actual question, I would clear the adjusting portion first, and then unless the joint is so tight that I can't get to and feel where I need to be. So I typically clear the adjusting, then I'll go in and clear the soft tissue. And if it's at that point where you've brought in this new normal, or this new end range of motion, that is what we want to work exercise-wise, okay? Because you end up with the whole issue of cortical mapping that plays in, right? So if you've not been in that, if you've not accessed that range of motion for however many months, years, whatever, you're not going to have real fine control over it, because you're not going to have it very well understood proprioceptively. So we need to train that before you decide to go do about 100 kipping pull-ups in a row. You're going to hurt yourself. Yeah. Right. So there's that rehab aspect.
Gotcha. And then do you work typically top down, shoulders before hips, hips before shoulders, or that's
kind of driven by patient complaint.
Okay.
Somebody we had our pick with you, right? As a runner, we could have done, your hips are pretty tight. If you're, depends, it's all patient driven, right? Like everything else should be, and it's just overhead athletes, people who work at desks, everybody's internally rotated.
Right.
That's what we're doing. We're helping them unlock that, unload that. So.
Yeah, I love it. So if you haven't checked out Drop Release, I'm going to drop a link down below, and you can head on over, check out the instrument, see what it's all about. I know Chris is also producing a lot more educational videos that kind of show you the ins and outs of how to utilize it. What protocols can you utilize to get better results with your patients ultimately. I think of it as something that doesn't replace, it adds to the care. It enables you to do exercise and active care at a higher level, because people are accessing that range of motion they're not going to get otherwise. And certainly from an extremity standpoint, I'd always recommend, if you're working spine, look at the next joint over and see what's going on. And who doesn't have athletes or non-athletes for that matter who are spending too long at the computer, who have poor hunched over posture, and all of that fun stuff that is not ideal and drives them to call your practice. This is a fantastic tool to utilize. Get in there on the muscles, get in there on the joints, outside of the spine, make sure they're moving, and get better benefit with everything you are doing in your practice. So if you haven't checked this out, again, I'll drop that link down below, and you'll be hearing more from Chris and I soon. So have a great night. Bye-bye. Hey, what's going on? If you loved that video, be sure to subscribe to this channel. The Evidence Based Chiropractor puts out videos all the time at the intersection of marketing and research, showing you how to grow your practice while also growing your knowledge base. So if you liked it, be sure to comment down below or hit subscribe, and I'll see you in the next video.